When the sun rises in Busia and Siaya, it brings in fresh memories of the past. Families have lost loved ones. At the end of 2009, 33.3 million people were living with HIV. That same year, some 2.6 million people became newly infected, and 1.8 million died of AIDS, including 260,000 children. Of all people living with HIV, 68% are in sub-Saharan Africa, where there are an estimated 10.6 million people needing antiretroviral therapy.
Wakati huo nilikuwa na CD4 ilikuwa 16, na kupitia kwa mafunzo ambayo tunapata na kuzingatia ile kanuni ambayo tumefundishwa kuhusu kumeza madawa, CD4 yangu imeimarika.
In light of this fact, Kenya declared HIV/AIDS a national disaster in 1999. It was time to put heads together and save a dying nation from the cold, untold truth about HIV/AIDS, which is a highly neglected area by many institutions. The Health and Social Services Department of the Kenya Red Cross Society took the challenge of walking the talk in HIV-related cases. It placed a firm target on contributing to Millennium Development Goal 6 to combat HIV/AIDS, malaria, and other diseases. Recent government statistics show that at 15.4%, a figure almost double the national prevalence, Nyanza province had the highest HIV prevalence of any province in Kenya. Western province borders Nyanza and had a prevalence of 5.7%, up from 4.9% in 2003. Risk factors include low rates of male circumcision, multiple concurrent partners, and high rates of herpes simplex virus 2. This virus causes genital herpes, which increases chances of HIV transmission or acquisition. These challenges are compounded by the high level of stigma and discrimination towards people living with HIV.
Tulikuwa na behavior zingine ya culture zimechange.
I have offices, I'm staying within my house, so I know how to relate with other offices outside my house.
Nisaidia kata kama mimi niko mgonjwa, nakuja wakaniletea dawa, kumeza, nikapona.
Tulikuwa na behavior zingine ya culture zimechange.
A frequently asked question is, who takes care of the people living with HIV/AIDS, orphans, and vulnerable children? The care of these victims is especially difficult due to the day-to-day deterioration of their health. However, as a result of a 58 million shilling donation from the American Red Cross Society, the Family Health and Home-Based Care Project is being undertaken in Busia and Siaya in Western Kenya region. The main economic activities practiced by people covered by the scope of this project in the area are farming and fishing. However, they face difficulty sustaining them due to the various challenges they face. The Africa region proposed to implement a 3-year comprehensive HIV/AIDS prevention, care and support program in Kenya starting in January 2009. The goals of the project were threefold: to decrease the incidence of HIV,
our partnership with Kenya Red Cross, though not so long, but for the short period of time we've had them around, it has been quite good, especially in support of our clients. At the care and treatment part, Red Cross gets in to improve the quality of their lives at home. They support them with various items. You realize even the overseas, some of them are well taken care of by Red Cross.
To reduce HIV/AIDS associated morbidity and mortality, and to improve the quality of life of the chronically ill in Siaya and Busia districts of Kenya.
Tulikuwa tumekaa chini watu wenye tulikuwa tumepimwa HIV, tukakaa chini to form a group that will help us to support each other. Tunataka kuunda fish pond ili tupate nutrition supplement and IGA wana adhere to the drugs, wana disclose their status easily. Saa zingine tuna support hata offices, tunafanya group therapy, and also tuko na shamba yenye tuna weka vitu kama mboga na pia mahindi. Sana behavior imechange kabisa juu zamani tulikuwa na behavior zingine kama inheritance, hizi zimechange. Tulikuwa na behavior zingine ya culture, hizi zimechange.
Mimi mgonjwa naishi na virusi. Napenda kuishi na virusi. Wenye wananihudumia walisikia kweli mimi ni mgonjwa. Sasa Sofia akasikia, akakuja akaniona, kanipeleka kwa hospitali, wakanipima, akasema sasa wanipeleka, nilikuwa mwembamba kabisa, wakanipea chakula. Sasa hii wananipeanga chakula.
Naona maisha yangu yameanza kubadilika kwa sababu nimeanza kujifunza, ni at least niko na ujuzi kidogo na naweza nikajiendelesha katika maisha ya baadaye. Ninataka kushukuru sana kwa Red Cross kwa sababu imeweza kunisaidia mahali penye ilinitoa mbali, na saa hizi naona afadhali, niko na tumaini katika maisha.
Nitakuwa na akili yangu na nitakuwa naweza kufanya kazi zangu. Ningewaambia kwamba ni asante sana, maana wameniwezesha nikapata akili zangu ambazo naweza jifanyia kazi na nikapata riziki yangu.
The American Red Cross, together with the Kenya Red Cross Society, responded to the needs in the two counties, while at the same time building on the success of current HIV/AIDS activities. The American Red Cross's role in the project was the provision of project funding and technical support, particularly as it relates to HIV/AIDS interventions, monitoring and evaluation, managerial support, as well as finance and compliance oversight. The Kenya Red Cross Society was responsible for the direct implementation of the project in partnership with the Ministry of Education, since some of the implementation components were in schools. It was through this close partnership and adoption of best practices that adequate care could be provided to orphans and other vulnerable children.
HIV and AIDS was treated as a foreign disease, scaring and all that, but now the pupils have knowledge about it, they have the facts, stigma has reduced, and apart from that, the spread of HIV has reduced, absenteeism in school has also reduced, and we are also feeling that behavior change has taken place so far.
We do quite some activities with the Kenya Red Cross. We do have peer counseling, we have child counseling, and they work with our schools, they train the teachers, and they also give support, provision of uniform for the orphans, and various other assistance that they do give to the pupils in our schools.
The project acted as a strong pillar at the community level in HIV prevention.
Patrons have come together, they've registered as a group. They're now working towards writing proposals for funding. And then we've also trained in-school peer educators for them to be able to continue training others and reaching out to them with peer education program.
Care and support.
Huyu wazazi yake alikufa, alafu akawacha yeye kama yeye bado mdogo, na yeye alikuwa mgonjwa. Red Cross nafundisha mimi vile naweza kuishi naye, vile kliniki yake ikifika napeleka yeye bila kuchelewa, hata madawa na meza kwa saa bila kuchelewa.
How the farmers are, at least by now I can say the program has improved.
It also enabled strong relationships to develop with programs run by other partners in the region, working in areas such as the provision of antiretroviral therapy, the prevention of mother-to-child transmission, voluntary counseling and testing services, and sustainable agriculture, which lacks a strong community presence.
Farmers at the farming community, but to Red Cross they are clients. These are persons who've been affected or infected in one way or the other, and we would not want them to be food insecure. That is, we are trying to improve on the farming methods. We are trying to engage them in, such that by the end of the day they have, we are taking care of nutrition, we are taking care of food security, and we are taking care of income.
The main focus for the project, which has been running since January 2009 and comes to an end in July 2012, was to increase the capacity of families and people living with HIV.
Out of the population of 405, I have quite a number of them as orphans and vulnerable cases. And sometimes I do come grave cases that needs my attention, and I do the needful to consult some people who can at least help me. What enabled me so much is that at one time I was down in life and Red Cross came to my aid, and that was a challenge to me. So combined with that, as my profession dictates it, looking at the welfare of the children. So having the two together makes me move on with some of the challenges and get to address them. We thank God so much that up to now we have moved some steps, and we have managed to put them a shelter, and we are making ways on how to solicit for more assistance together with Kenya Red Cross, which has been handy enough to give them a bread basket every time and again and some school uniform.
I tested positive in the year 2004. When I tested positive, I started just taking my drugs immediately, the ARVs. But by that time, I started volunteering for Red Cross. As a community health worker, we were selected. We passed through our communities, which they selected us as able people. We were trained by Kenya Red Cross, and they gave us the right material. And from there, when we entered the community, I found it easy. And being a Pulwa, I'm very much able to relate well with the Pulwas and other chronically ill people. And in the sense that I'm also a widow, I have offices, I'm staying within my house, so I know how to relate with other offices outside my house also. The seminars which are being held by the Kenya Red Cross, we talk about adherence, so it's just easy. You go by, and sometimes you find the drugs themselves can make you sometimes feel you are so much tired, but when you follow the instructions, you just get well.
Red Cross imenisaidia wakati nakuwa mdhaifu, huwa inanisaidia vyakula. Alafu wakati niko na nguvu huwa wananisaidia na mbegu na mbolea. Wamenisaidia na kujua kulima.
And improve the quality of life of the chronically ill through the provision of home-based care and support.
Nisaidia kata mimi kama mimi niko mgonjwa, nakuja wakaniletea dawa kwa meza akapona. Imenitunza tangu nikuwa mdogo.
Also aim to increase the capacity of families and improve the quality of life of orphans and vulnerable children.
I know the Kenya Red Cross has been very, very active, particularly when it comes to projects to do with the orphans and vulnerable children. It is an area where Red Cross has been doing very well, and we hope to continue working with the Red Cross.
This program has also resulted in the improvement of HIV/AIDS related knowledge, attitudes, skills, and behaviors of youth in the community.
What's HIV/AIDS? Mafunzo haya ambayo tumepewa wamerespond kwa njia ambayo inafaa. Juu ukiangalia katika tulipoanza hadi wakati huu, vijana wengi wameitikia mwito wa kukubali mafunzo yetu, na wengine pia wamekubali hata kubadilika.
wamekubali mwito wa kwenda katika vituo vya afya na kujua hali yao. Wengine wamekubali kukaa na sisi kupata mafunzo kuhusu jinsi ya utumizi wa mpira ya kondomu.
The Kenya Red Cross Club is a club that was founded in this school 3 years ago. We recruited youths, young girls between the age of 8 years to 15, and we are teaching them or trying to share ideas on family health and how they can be able to take care of themselves and some diseases that affect them and the community.
And builds the capacity of the Kenya Red Cross Society to handle such cases and programs.
This project and how it has also built the teams in terms of knowing what exactly the supervision of governance in some of these related projects.
For the home-based care, we've established a HBC desk in one of the health facilities in Barachuth, just to ensure that there is referrals, quality referrals from the health facility to the community.
Orphans and other vulnerable children in the community were helped in various ways. Some received material help, some were taken to school, others benefited from full school uniform kits, while others got health attention.
Tumewasaidia zaidi kwa sababu target yetu tuna target watoto 250 kila mwaka, na kwa hivyo imesaidia wale ambao hawajiwezi zaidi, na hiyo imewezesha watoto kuwa shuleni, wale ambao walikuwa wakikosa kwenda shuleni kwa sababu ya sare na hata mahitaji mengine kama viatu, pia imesaidia kiafya.
We have established OVC committees in the two sites who will be handling OVC issues once the project has phased out.
The components that were successfully implemented are set to continue so as to become long-term measures and sustainable aspects of the project once it's phased out in July 2012.
Mkakati ambao tulikuwa nao, tulisema kwamba dona atakuja na aende, na sisi ni watu wa community tutabaki. Ndio maana tulianzisha hii IGA. Hii viasi ambao tumepanda na sema kwamba inatusaidia upande wa nutrition.
One of the key sustainability areas is to work with the Ministry of Health, Public Health and Sanitation, because that is one of our partners that we've identified will be handing over the HBC component.
There are also some of my friends who were not actually ready to give out their views, how their lives are. But you find that right now they are free, they don't have any stigma, they are just free, they can communicate freely.
Most of the youth have interacted within Red Cross. I've really tried to come closer in terms of behavior change. So we are just encouraging people to do the local resource mobilization for the sustainability of the project.
Focusing on reducing incidence of HIV and reduction of HIV/AIDS associated morbidity and mortality of the chronically ill in the Siaya and Busia districts, a strong team was formed, which included community health workers, prevention assistants, focal persons, home-based care assistants, health managers, Red Cross club patrons, and the project officer.
Initially, talking about sex was a challenge to the community. It was just left for the individuals to talk about it. But now, they can always share. The community can share, they can talk about sex freely. The orphans and vulnerable, at times they always drop out of school. But the Red Cross has helped. Since we started this movement, we have been looking for these children, orphans and vulnerable children.
In schools, co-curriculum activities have gone a long way in spreading the gospel, and these have seen the general behavior towards HIV-related activities change. The impact of the project was resonating not only in the initially targeted area, but also as far off as Nyalenya area in Siaya.
Ile support group itafanya tuwe na hali mwema. Tukaingia kwa support group. Sababu tulikuwa kwa support group tukaona sasa hatuna tuko wengine ili tunasema fulani atasema nini kwangu ama nini. Hasa kuna kitu mimi najua tu hali yangu sasa kivyangu. Sipokuwa imenisaidia.
A key feature of the project that needs more support was the sustainability aspect. To achieve this sustainability, Red Cross Society most of the support groups have embraced income-generating activities. For institutions like prisons where the project was implemented, Magnet Theatre was quite a useful tool. It has been embraced and the inmates have taken up the task of preaching about HIV and how it spreads, especially in such institutions.
Our prisoners are changing as far as behavior is concerned. We've seen prisoners ward meetings, we've seen them talk to others, we've seen them change the way they were thinking about HIV and so many other things that are related to HIV and AIDS.
And peer education again in prison. We've capacity built the prison management, that is the officers plus the inmates, and we've trained them in peer education so that they can continue with these peer education activities as well without much support from the project once the project has first started.
With a few months to the closure of the project, a key feature of the project that needs more support was the sustainability aspect. To achieve this sustainability, most of the support groups have embraced income-generating activities. For institutions like prisons where the project was implemented, Magnet Theatre was quite a useful tool. It has been embraced and the inmates have taken up the task of preaching about HIV and how it spreads, especially in such institutions. 520 youth, provided prevention education and stigma reduction training for 6,984 community members, and finally built a capacity of 283 KRCS staff and volunteers. With its achievements so far and its strong volunteer base, it is believed to be amongst the best implemented projects in the recent past. This project is a strong testament to the Kenya Red Cross Society value proposition, always there.
In different countries across the globe, the greatest stories are never told. It goes just around and round again. It goes just around and round.
The greatest stories are never told. It goes just around and round.